Today, we're diving into a topic that regularly stirs up debate in the thyroid community. It's the issue of natural desiccated thyroid medication, known as NDT. Let's separate the fact from fiction. First, a quick history lesson. In the 1880s, doctors began treating hypothyroidism using animal thyroid extracts. By the 1930s, natural desiccated thyroid, or NDT, became the first commercially available thyroid drug, a lifesaver for many. Fast forward to today, and NDT is still used. But despite more than a century of success, it's been pushed aside by synthetic medications like levothyroxine. So, why the controversy? NDT is made from the dried thyroid glands of pigs, and contains both thyroid hormones, T4 and T3. In contrast, levothyroxine is synthetic and only provides the T4 hormone. NDT might be right for you if you're still struggling with hypothyroid symptoms, even though your levels look fine while taking levothyroxine. It may also help if you don't have a thyroid gland, or you have trouble converting T4 into T3. But the only way to know for sure is to try it under your doctor's supervision. There are several myths surrounding NDT. First is that NDT is too old-fashioned. But it's been used safely and effectively for more than 100 years. And doctors regularly prescribe other old-fashioned drugs such as aspirin and penicillin. Next, some doctors say that levothyroxine is more effective than NDT. But recent studies show that many patients who take levothyroxine still have abnormal test levels and continued symptoms. And research has shown that among patients who have taken levothyroxine and NDT, more patients prefer NDT treatment. One incorrect attack on NDT is that it's not FDA approved. But here's the thing. NDT was in use long before the Food and Drug Administration came into existence. As a result, the FDA grandfathered NDT and never required a new drug application. While NDT is not officially FDA approved, it is regulated by the FDA and legal to prescribe as a hypothyroidism treatment. Some doctors don't support NDT because they say T3 levels are too high when taking it. Because T3 peaks quickly in the body, usually within 2 to 6 hours, patients taking NDT have higher T3 levels and T3 to T4 ratios than patients taking levothyroxine. Studies have shown, however, that at appropriate doses, NDT normalizes thyroid levels and eliminates the signs and symptoms of hypothyroidism equally as well as levothyroxine, with no adverse side effects or excess risk. The silliest claim is that you'll get mad cow disease from taking NDT. The fact is that all NDT drugs in the US are from the thyroid glands of pigs, not cows. No cases of mad cow disease have ever been associated with prescription NDT drugs. Finally, you may be told that NDT is an over-the-counter supplement and doesn't require a prescription. This isn't true, and it shows that someone is confusing NDT with over-the-counter thyroid glandular supplements. All NDT medications require a doctor's prescription, and NDT is not available over-the-counter as a supplement. If you're interested in trying NDT, the challenge might be finding a doctor willing to prescribe it. But there are options. You can search for an NDT-friendly doctor at Get Real Thyroid and Thyroid Change. And Paloma Health offers doctors who specialize in hypothyroidism care, including NDT treatments. Here are some tips on taking NDT. When starting NDT, take it in the morning with water, and wait an hour before having coffee, milk, or food. And take any supplements with iron and calcium 3 to 4 hours apart. You can also ask your doctor about dividing your dose throughout the day for better results. NDT might not be right for everyone, but for some hypothyroid patients, it can make all the difference. If you're interested in learning more, reach out to Paloma Health to speak with a thyroid specialist. This video has been brought to you by Paloma Health, the nation's leading medical practice dedicated to hypothyroidism care. Learn more at www.palomahealth.com.